He's the grumpy Gus of England's National Health Service, fond of saying idiot and get out of the way. He is most definitely not your congenial family physician. In fact, he's quite the opposite. He's a pain in the backside. But there's more to Doc Martin than a global TV hit, if you know what to look for, starting right now. Hello, I'm Hunter Schultz. Welcome to another episode of Winning Healthcare Food Fights Without the Mess. On this episode, I thought I'd take a look at Doc Martin. Like many of you, I've been binge watching a lot of TV of late, simply because you can't do much when you're locked down during this COVID-19 pandemic. And I've seen Doc Martin listed in my Netflix index, but I've always sort of passed over it. Why? Don't ask. I have no idea. Maybe it's because I thought it was about shoes or boots or something. For those of you who don't know, Doc Martin is a British TV show, and it is a wildly popular TV hit globally. It premiered in 2004, and I'll leave the spoilers out of this episode, but suffice to say, it's brilliant. It's so well done, and it's worth your time. The title role of Doc Martin is beautifully, wonderfully, brilliantly portrayed by actor Martin Clunes, playing the title character of Dr. Martin Ellingham. And there's a running joke about his name, which, again, spoilers, I'm not going to relate all that. He was a surgeon, a vascular surgeon in London, and a brilliant one, well known. He had a phobia, which meant he couldn't practice surgery anymore. And he had to reinvent himself. And he became a general practitioner, or the equivalent of a family medicine physician in the U.S. So Doc Ellingham moves to Port Wen in the West Country, Cornwall to be exact. Port Wen is a fictional fishing village, beautiful, picturesque. It's actually Port Isaac, and you can find that on Google Earth. It is stunning. It is beautiful. He brings his phobia to Cornwall and Port Wen and unleashes it upon the local populace. You soon discover that Doc Martin has a rather unusual way about him. His bedside manner isn't exactly nice. He lacks social skills. You don't bring him to a cocktail party. You just don't. So I grew up watching Marcus Welby, MD. And Marcus was the doctor we all wanted because he had a good bedside manner. He cared. He had time. He had time to listen. Back then, medicine was different. We're talking the late 60s and early 70s. So doctors were less encumbered by government rules and regulations and insurance companies' rules and regulations. They have more time to think. They have more time to listen. And Marcus Welby was the doctor that was our prototype. It was what we had in mind, at least my generation and older. Something else about Marcus Welby, though, and that was, it was his way or the highway, which was typical of doctors in medicine back then. Doctors were the gods, and you did what they said, and you didn't argue. Well, that's changed a lot since then, and I think most people would agree healthcare's better for it. It's no longer my way or the highway. Patients and doctors work as teams, which is a good thing. much of Doc Martin's allure, fun to watch factor, is the fact that he does have these issues, social skills, lack thereof. And in fact, it's been pointed out that if you did lighten him up, if you did make him more congenial, the show really wouldn't have much to go on. I mean, that's a big part of what makes the show so watchable. And you come to anticipate the eye roll moments where you think, oh God, what is he going to do? There's a lot of comedy in this show. Now, if you've been following this show and you've been listening to what some of the doctors are saying, you can see the problems quite clearly as you watch the series unfold. A major plus to Doc Martin is the fact that medicine is portrayed accurately on the show. In fact, Dr. Martin Skur, a retired GP, is the show's medical advisor. In a TV interview, he related how the compliance department of the network said that in order to show it on the program, it has to have happened somewhere in the world. Good thinking. Hence the reason for the show's accuracy. A couple of points that I'm recalling. A recurring theme in this show is drug interactions. And some of them are quite comical. Thankfully not too serious. But they make the point of even supplements, vitamin supplements, can have a terrible effect if you're taking prescription medicine. And that's a good point for most people to understand. And that's where having a great doctor in your corner, providing your care, and the conduit for communication. Hey, doc, I'm taking a new supplement. What do you think? Or I'm going to. Getting that feedback before you take the supplement. Good idea. Doesn't happen in most cases in the American system. Apparently not even in the NHS. In one episode, one of the characters is training to get her certification in something. And she decides to have her boyfriend help her with her CPR training and proceeds to do CPR on him. And Dr. Skur, the medical consultant to the show, received a lot of emails from his colleagues, his peers, saying, what are you using a live person for? And he said to them, that's the point of that part of the episode. Don't practice CPR on someone whose heart is beating. In one TV interview, Dr. Skur mentioned the doctor can be a bit strange, but he can still be very competent. And I think that's a good point. The competency that he has, that it saves him. And more often than not, because the community has gotten to know him over time, and you see this, they begin to realize just how bloody confident this doctor is. And so they come to appreciate him more, and they tolerate his eccentric behavior. In the interview, Dr. Skur connects some important dots between Doc Martin and direct primary care, DPC. And I'm going to read his quote because I think it's important to set the stage for that. What matters is that he's available and he communicates and he gives continuity. And that's a good message for general practice. So let's take that point by point. Indeed, he is available. It's a small fishing village after all, so most of his patients are parading by his door from time to time. Another factor is that even though he is in a rural area, some of his patients are outside of the village, which brings to mind logistics as something. If you've been viewing the show for any length of time, you know how important logistics are. Certainly during COVID, telemedicine has become more important. So the village is close. He's available. In fact, the house that they use for his office, they call it a surgery over there, the NHS. So it's his surgery. Another point is that he communicates, but he's rather grumpy, and borderline brutal sometimes. It's cringeworthy, as a matter of fact. But there's a lot of comic relief, too. His communication style is poor, because when he was a surgeon, all his patients were, frankly, knocked out. A GP has a whole different ballgame, and he soon discovers that after he arrives. But I think out of the 3 points that the doctor made, the one that stands out for me is continuity of care. The more shows you watch, the more you realize he's picking up on things. And that continuity of care, knowing your patient, knowing who they are, it's so important. The sad part is he's hamstrung by his personality. As I've watched the show, I've been thinking, what if his bedside manner was more normal? How much faster he would learn about his patients, how much more he would learn. That's an important point. About the insights he'd come to know, where his patients live, work, and play, how they live, work, and play. Many times during the show, you see him discovering these things, but he's in problem-solving mode rather than problem prevention mode. If only he had the social skills and a better bedside manner, how much easier his job would be. And I think that's something that's been troubling me towards the last few seasons. He's intelligent. Why isn't he figuring this out? It's good TV. I think Doc Martin has some interesting possibilities to explore. Where the NHS is going in this new age of personalized medicine that we're in. How is he going to deal with that? How is he going to deal with needing more time to think about a patient? The future is sort of bleak for Doc Martin. Medicine's been changing a lot over the last 20 years or so. In fact, you can see it in his crowded waiting room at the surgery. Also the time with the patients. He doesn't have a lot of time because of the crowded waiting room. And in real life, British GPs are complaining an awful lot about 10.5-minute consults. They know it's not enough time to figure out what's going on with their patients. On top of that, where's the thinking time going to come from in order to connect the patient's dots? Their diet, their exercise, the genome, the gut microbiome, all the things that we've talked about on many episodes. Where's the thinking time going to come from? Please tell me that. It's a good question to be asking. So the National Health Service has some significant issues ahead, and most healthcare systems have it. I think it's a great opportunity for the show to explore those and how Doc Martin will react, how he'll deal with them, given his eccentric nature. So as medicine is changing at a rapid pace, hopefully we'll get to watch Doc Martin handling it, or at least try to. But you know, that's what makes this great telly, as they say in England. Personally, I'm looking forward to watching the rest of the story unfold. I have some links in the description, some of the research I did in doing this show. And I'd love to hear your comments if you've watched it, what you think of it. Probably the most important question is, would you want him as your doctor? For Winning Healthcare Food Fights Without the Mess, I'm Hunter Schultz. Thank you so much for joining me today. And remember to wash your hands a lot. And there you are.